Because he looks like any other kid, there's no cue that there might be any problem with him. And so when he does something that's odd or has an unusual reaction to something, people get very, very annoyed and impatient. Someone that, is on crutches, it's obvious, maybe you could help them with a door. When you don't have any visual cue, people just make snap judgments, and it gets very frustrating for him and for me. And to be honest, I do the same thing. I forget that sometimes he's different now.
A few years ago, Tyan's son Alex fell about 15 feet off of an escalator railing. He fractured his skull, he had bleeding in his brain, he had a traumatic brain injury. Alex is able to walk and to talk. He looks normal, but he still struggles with cognitive and emotional difficulties. Tyan, you mentioned that at times it felt like you were taking one step forward and 3 steps back with Alex. Tell me what you mean by this.
The best way to explain it is early on, very quickly after his injury, he was having problems with really mundane daily tasks. We were seeing this therapist weekly, and it was a lot of practice. It was a lot of sequencing. It was a lot of trying to get organized to remember these processes. He would do really, really well for a few days or even a few weeks. And I would think to myself, oh, he's got it. This is great. We're making progress. This is wonderful. And I'd get so excited. And then the next day, it was like all of that information was gone. Or maybe he would do really, really great with showering, but then he would come out after a shower and his shirt would be inside out or backwards, or he couldn't put his pants on because he held them up, and he held them up legs first and they were upside down, and he didn't recognize what they were. And then I'd be frustrated all over again. Like, we did this yesterday and you were just fine. And it took me a long time to understand that he was not doing it on purpose. He really didn't understand. He really, truly couldn't remember. There were some days it was like starting over every single day, or there were some days he would look at me with complete confusion, like he didn't even understand the words that I was saying. And so we weren't even just starting at the beginning. It was like we had slid backwards so far, I couldn't even see where we had started. We all make progress some days, and we all have bad days, but for people with head injuries, they're a lot more pronounced. And it's really important to not get frustrated and not take it personally when they can't remember something, because they're trying, they really are trying, and they're not doing it on purpose, and they are just as frustrated as you are.
Can you tell us about some of the emotional difficulties that Alex has had?
Well, I would say the one with the farthest reaching consequences are anger management. Before the accident, Alex was a really mellow kid. He was really happy-go-lucky, and now his reaction to anything is typically anger. We are on this roller coaster of emotions all the time, of extremes back and forth. There's no such thing as just an okay day. For a regular kid, something that might be disappointing will cause tears and tantrums for hours or possibly days.
How has this affected your family?
Anyone that lives in a family understands that anything that happens to one person happens to everybody. It's going to have some sort of effect bleeding over into everyone else's lives. For me personally, I would say that I am a lot more anxious and hypervigilant than I used to be. I'm always paying attention to what he's doing and how he's progressing. But as a parent, you try to teach your kids and help them to be as self-sufficient as possible. And so you also don't want to take things away, experiences away that are going to benefit them, and teach them something. You try to let them navigate as best they can, but you have to pay a lot more attention to when they have different needs than any other child. It's really, really hard on a marriage. There are a lot of financial consequences because there are extensive doctor's appointments. There are a lot of additional needs. It even changes the relationship with the non-injured child or children in your family, because they don't understand the differences all the time. My boys used to be the best of friends, and my older son, I've spent many nights with him where he's crying saying, well, why can't he just be the way he was? Why isn't he, can I just have my brother back, please? And it's heartbreaking to see the change in your one that's injured, but how much your other one wants life was good before, and they didn't ask for this change.
That's really important to know. I think that people struggle behaviorally and cognitively after a brain injury, and sometimes we want them to just stop it. We think they are doing it on purpose, and I think that's such an important point, that they're not doing it on purpose.
It would actually be easier if they were doing it on purpose.
Yeah, right. Okay. Tyann, what do you wish that you would have known early on that you didn't know that other people should know?
I would say you want to get as many specialists from different areas on board helping your child as quickly as possible. Brain injuries, a lot of times you kind of have this window where you're going to make good progress, and as time goes by, that window closes or even shuts entirely, and you kind of are stuck with what you have. We've had doctors in neurology, physical medicine and rehabilitation, optometry, ophthalmology, behavioral specialists, speech specialists, occupational therapy, education. We've had several different doctors from lots of different fields, and every single one of them has contributed to his progress. I wish I had known that in the beginning, because I feel like we lost a lot of time. We lost a lot of ground that we could have made and saved Alex a lot of frustration. I think it's really important to remember that you are your child's only and best advocate. No one else will do it for them. Doctors, as well-meaning and as professional and as capable as they are, they're never going to be as invested in your child as you are. So you have to do the research. You have to do the legwork. You have to keep, if there's a problem, something doesn't feel right, you need to keep looking, you need to keep researching, and you need to keep asking questions, because that will eventually lead you to someone that can help you. I wish I knew at the beginning that it's really important to not give up, even when you feel like you're not making progress. Every single time that I wanted to stop, and it seemed like someone was put in my path that said, don't quit, I have another idea. And eventually that idea led to something that was really beneficial.
As I listen to you, I see that being a caregiver is really difficult. It takes a lot of energy. How can caregivers take care of themselves?
What I wish I had known at the very beginning, in order to take care of myself, you can only be as good an advocate, as good a caregiver as you are taking care of yourself. So I would encourage you to get as much sleep as you can, the best nutrition you can, and get exercise, which sounds very, very odd, but just the physicality of going to all of the appointments is exhausting, in addition to taking care of the physical day-to-day needs of someone that has an injury is physically very demanding. It takes a lot of strength. You have to remember to ask so many questions, and then you have to be able to integrate and retain all of the information that's coming to you from multiple caregivers. You're not going to remember all of it, but you want to remember as much of it as you possibly can, and you can't do that if you are exhausted. It's also really important to know that there are more resources than ever before for TBI survivors and for their caregivers, because it is an unbelievably difficult thing. It's probably the hardest thing that I have ever had to do. I would counsel people, do something that is for you, that is independent of the person that's injured and independent of any of their treatment regimens. Do something that's completely outside of all of those things so that you can recharge. Find something you enjoy. If you can do that, you will be a better caregiver, because you will resent the situation less, and you will start to resent the situation if you don't give yourself a break. I would also say you need to find someone that's completely independent of your family, your providers, someone that you can be completely honest with. If you can find that friend that, even if they don't understand the situation, but they are invested in you, that you can be totally honest with, and that friend that can take that will be invaluable. They'll be worth their weight in gold to you.
Tyann, you've done a remarkable job with Alex. I mean, he's come so far, and thank you for all this wonderful information. I think it will help a lot of people.
Thank you. Thank you for having me.
You're welcome.